Judy, this week you were able to offer the vaccine to the first employee. Tell us a bit. How did that go?
Well, it's not often that we celebrate here at TMC these days, except when we send people home and they're better. But it was truly a celebration to take the first vial of Pfizer vaccine and get doses into the arms of 6 of our employees. They felt honored. We had a couple of nurses, a couple of our housekeepers, one of our cardiac surgeons, a respiratory therapist, people who are right there in the middle of it on the front line, getting this little teeny tiny dose of hope in their arms. It was truly wonderful.
What's the plan for over the next few weeks here?
So we have close to 6,000 doses. We have a drive-through in what's called Lot 29, the far northwest corner of our 120-acre campus. So those people have pre-registered already. They don't even have to get out of their car. And then in our Marshall Auditorium, we're going to be doing primarily our own employees. So they'll just walk over from their work area and get their vaccine and go back to work, or come in on their day off. So we think between those two areas, we're going to be doing, as I said, 700 to 800 doses a day. We're going to just keep giving them until we run out of our Pfizer vaccine.
You're a nurse yourself, and you know that not everyone is comfortable with a vaccine. I imagine you have some employees who are concerned. What is your message to them?
Well, that's been one of the really wonderful pieces of this recently is that 3 weeks ago, we did a survey and we asked all of our employees, when the vaccine comes, how many of you will take it? We probably had about 65% who said that they would, and maybe another 20% who said, I'm on the fence. The fence people are now, sign me up, I want the vaccine. So the wonderful momentum that's coming out of the rest of the country, the FDA, the confidence that we're having in the clinical trials has really boosted everyone's opinion that this is something safe and I want to be a part of it.
And finally, I know last week TMC employees penned a letter to the public asking for support because these are precarious times. What is your message here as we head into the holiday season?
That people are contracting the virus mostly from family and friends where they let their guard down. They are inside, they are in a restaurant, they take their mask off. If you wear a mask, you're safe. It's really an airborne disease that we need to be vigilant about. We can stop it, and we're right here on the edge of a vaccine. So what a terrible time to contract the virus now when the help and the hope is just right here in front of us.
In this initial phase, TMC and Banner Health are coordinating with Pima County. The leader of these efforts, County Health Director Teresa Cullen, tested positive for COVID-19 this week. A statement from the county said it was part of a larger outbreak at the health department. The day Cullen's diagnosis became public, we asked Pima County Chief Medical Officer Dr. Francisco Garcia about whether that would set back the county's efforts to roll out the vaccine.
We have a group of highly qualified, very smart individuals, over 200, almost 300 individuals who are part of this response. They are very motivated, very talented, and they are getting direction from Dr. Cullen, as well as from Mr. Huckleberry. And so I have no doubt that we will not miss a step. We will not skip a beat here. We are poised to do kind of our vaccine rollout, and there is no change in terms of the time frame or the timeline.
As I understand it, 11,000 vaccines in this first batch to go here probably by the end of the year. Is that right?
Well, the number changes. So I can tell you that we have about 9,000 doses that have been received at this point by Banner and by TMC. We have been promised another very substantial number of doses. I don't want to count the chickens until actually that vaccine truck is here and unloading those assets.
Dr. Garcia, you and I have been talking about this for about 9 months now. How hopeful are you that we are, as a county, headed in the right direction to get a hold of this virus?
Lorraine, we needed a shot in the arm, and the vaccines, both literally and figuratively, are what we need. Uh, as I look at our epidemiologic curve, as I look at the number of cases that this community is experiencing on a weekly basis, I keep thinking that we can't possibly have more cases than we did last week, and yet we have. That's been the case for the last 4 or 5 weeks. Um, this is a ray of sunshine. But one of the things that is really critical for us to make sure is communicated to everyone is that we won't see the impact of these vaccinations until the future. And so until a substantial number of people get vaccinated in this community, probably somewhere in the 75% range, until then, we really won't have the kind of community immunity. Some people call it herd immunity, the kind of community immunity that we need to be able to resume most of our normal life and activity. So I want to put that. I don't want to be a downer, but I also want to put that shot of realism into the expectations. This is the best news that we've had. The fact that we have not just one, but maybe as soon as tomorrow, a second vaccine in our back pockets to be able to deliver is amazing.
Okay, one day at a time for sure. All right, Dr. Francisco Garcia from the Pima County Health Department, thank you.
Absolutely.